Thank you for joining us. With us is Dr. Taylor Shank, clinical psychologist specializing in perinatal counseling here at Meadville Medical Center. Doctor, good to see you. Thank you so much for your time.
Yeah, thank you for having me.
Let's learn about you. Tell us where you're from.
Well, I'm from Guys Mills. So I grew up around here. I moved to Oregon to do my graduate training, my postdoctoral training as well. So, and now I'm back.
What was that process like for you? How did you know this was the field you wanted to get into?
That's a good question. At first I didn't really know. I chose psychology as my major when I started college and kind of thought, maybe I'll stay with this, maybe I will change majors at some point. But my first psychology class, I just fell in love with it. I like learning about neurons and brain cells and why we do what we do, emotions. I fell in love with it. I never thought about changing direction after that. And then each step of the way, I just kept learning different things that I was kind of more of my own niche with it. I learned about mindfulness-based interventions, and then started working on that with pregnant women. So it just kind of all came together.
So we're going to get into the specialty side of it, but the reality is your patients can vary. It doesn't have to be just somebody going through pregnancy or postpartum. It's really a lot.
Yeah, so that's one of my specialties, but I am trained as a generalist psychologist, so depression, anxiety, PTSD, obsessive compulsive disorder, really anything I can see.
When did you start here at Meadville Medical Center?
In January.
Wow, and what brought you back to the area?
Well, so I always knew that I wanted to come back to this area after just seeing other places, other cultures and everything. I knew I wanted to come back here and work here. And then my partner and I had a baby, and so being close to our parents and things like that, that was really important to us.
So coming back, any surprises? Because obviously you were familiar growing up with Meadville Medical Center, but as an employee and coming back, what sort of surprised you?
Well, that's a good question. Just differences, and I was working somewhere that was more of a city, and I was near Portland, and then coming back to a more rural setting. Even though I'm from here, I hadn't really worked in a rural setting. I did 1 year in Johnson City, Tennessee, so that was rural, but working long term, that was different. I just kind of the things you talk about in therapy feel different. A lot of the times in the city, people have been in therapy like their whole lives, or are really familiar with what therapy is, how it works, thoughts, emotions, everything like that. And here, I mean, less people have been in therapy before. It's less common, less talked about in families. So that's just been an adjustment. It's been great. It's been fine, and I love explaining those things, so it works for me. But
was it sort of exciting to come here to Meadville Medical Center and see how much effort goes into patient care and making sure that there are things in place that you might not be thinking about? And we'll talk about your specialty in a moment, but just to know that there is that concern for patients and to make sure programs are here in place to serve the needs of those patients.
Yeah, so that was something also that was kind of different, going from a major city to a more rural setting. Just that provider-patient relationship is so strong, and that like personal care. I mean, you oftentimes don't just know a person as a patient, but they're your neighbor, or you know them in another capacity. So that care is very real and very personal. And then just working with the OB providers, working with the other social workers, psychologists at the Mind Body Wellness Center. We're all just so invested in our patients. We genuinely care about them, and we want to help people understand what therapy is, what it isn't, and to just provide that comprehensive care for our patients, that you're not just a body, you're not just a mind, you're a whole person, and we see you.
So let's get into the perinatal counseling. Tell us exactly what it is and what your day-to-day is.
So perinatal counseling, perinatal is kind of around the time of birth, so pregnancy and postpartum. I see patients up to 1 year postpartum. You don't have to see me that long, but that's what's offered. And it can be a range of different things. So primarily I will see patients who are experiencing depression or anxiety during pregnancy or postpartum. In addition to that, and I can explain more about that, like the signs, symptoms, that kind of thing too.
Sure.
But in addition to that, if you're experiencing anything related to like loss or infertility, miscarriage, loss of a child, those kinds of things where you're going through more of a grieving process, need a space to grieve, to cry, to just talk about everything you're feeling, that's something that I offer, as well as if you're going through like couples. I can see couples if you're having relationship challenges or just want to work on your communication, as well as the partner. This is something that doesn't often get talked about, but the father, partner, spouse, they can experience mental health issues as well, like postpartum depression, anxiety. So I could see just that individual as well. And then things like if you're struggling with substance use, whether that's marijuana, vaping, nicotine, alcohol, other things, like I can see people for those reasons. Really, it's kind of anything that's going on for you during pregnancy or postpartum, that like reproductive time period.
So during pregnancy, what are conversations that you typically hear? What are questions that maybe somebody's asking you?
Yeah.
And is there some sort of an assessment with that, or is that part of the beginning process of meeting with somebody?
Yeah, so during the first session, maybe couple sessions, you go through an intake process. So I'll be asking patients about what's bringing them in, what are they experiencing, and then kind of going into like family history, medical history, a little bit into their childhood, their, self-care, their hobbies, kind of just getting a whole picture of who someone is and what's happening, as much as you can in 1 hour of meeting with someone. A lot of the time, patients are kind of just wanting information about, a lot of the times it may be that it's their first pregnancy. They are scared. They don't know what to expect. They have a lot of anxieties, which is very common, very normal, and very expected too. So a lot of the times asking about how do I manage worries, how do when I get really overwhelmed, how do I take care of myself during those times? Is that normal? That's a big question. Is this normal?
Yeah.
Whatever it is I'm feeling and experiencing. So.
I know for me, I think it was putting our first son in the car seat and sitting in the car, and at some point my wife said, "Why are you driving so slow?" It's like, it's like it just hits you like,
this is
now you're responsible for this.
Mm-hmm.
And I'm sure within all of that, there are so many little side alleys you could be going down in terms of conversations and concerns.
Absolutely.
Let's say you get to the delivery, and now the postpartum process begins. What sort of questions are you getting afterwards? Are you seeing couples, mothers afterwards?
Mm-hmm.
And is it just the mother? Is it mother-child? Husband, wife?
Yeah, okay. Mostly right now it's just mothers. I see some couples, that's just for whatever reason right now, that's been more rare. I can also, that's a good point, see the mother and the baby if they're having challenges with bonding or kind of developing their attachment. That's something that we can work on. Sometimes it might be, I just feel really anxious and I'm afraid to hurt them or mess something up, and so I'm having trouble connecting with them. or if this was unplanned, unexpected, earlier than you wanted to have a baby, there can be a lot of resentment or frustration, just feeling that loss of your freedom and all of this responsibility now. So there's many reasons why you might see a mother and a baby. Primarily, like I said, right now I'm seeing like just the mothers, and we're spending a lot of time talking about mom guilt is something that comes up a lot. I feel like I need to spend every minute with my baby, and if I'm away from them, I feel really guilty, or I want to get back to them as quickly as I can, but then I'm starting to burn out because I'm not taking any time for myself. So how do I manage being a person and a mother? And then just all the feelings that it's a very existential time. Like we were kind of talking about, you're more aware of your vulnerability. You're more aware of that pull between freedom and responsibility, and all the decisions now for raising this little person are on you. And there's so many different ways to sleep, feed them, toys, screen time, no screen time. Like there's so many things and it's on you, it's up to you. So there's freedom in that, but then there's a lot of pressure and responsibility. So a lot of that kind of stuff comes up.
And, when you talk about postpartum depression, it's okay to feel certain ways. And this is part of the conversation I know you're having with your patients, but I think for some, the confusing part is there's excitement, but yet maybe depression, and you're fighting these two sides and trying to figure it out, and that's okay.
Absolutely. I'm really happy that we're talking about this, because there is this societal expectation and idea that it's just, you're glowing and it's such a blissful, joyous time. And it is, and it can be, and it might not. And oftentimes it doesn't feel like that 100% of the time. There is a lot of fear, there is sadness, there's anger, there's resentment, there's frustration, there's annoyance, we're full human beings that feel the full range of emotion. So there's all of it, but there's sometimes shame feeling those more like unpleasant things, because not a lot of people are talking about that. They feel judged or ashamed by talking about it. So then it's kind of all just happening in secret under the surface, and you don't know that you're allowed to feel like that. So I really try to help my patients know that it's okay. Well, like when I'm asking you how you're doing in our session, I'm really asking how you're really doing. I want to hear the truth, and that it is okay to talk about it.
Let's talk about the various stages that somebody may reach out to you. And I know you kind of talked about it, but I want to get specific.
So if couples are going through infertility, if they've been trying for maybe a year or more, that's a time when they could come in to meet with me. Yeah. And
then again, going through that process of the beginning part of pregnancy, what about if you've delivered, you're in the hospital, and you start to feel these things? While they're in the hospital, should they be asking to speak to you? Or is it one of those things where they should wait, get home, get situated, and then make that appointment? No,
that's something that could happen. It could be tricky just because of my days. If I'm in sessions all day, it might just not work out, but it's something that definitely ask about it if that's something that you're going through, and I could at least move things around and try to pop in for a couple minutes or something. But you don't have to wait. We can, even if it's just to talk about getting our appointment scheduled. Yeah, and I think that's probably what I was trying to ask is if you're kind of realizing this while you're still in the hospital, maybe it's one of those things where they should say something to somebody like, hey, maybe I think I need to talk to somebody once we get settled. Yeah, absolutely. Yeah. Okay. You said conversations could last a year after. Do they typically get resolved in that time, or are there some circumstances where maybe it would require more than a year? So that it's different for everybody. Okay. And since but if somebody hits a year and they're still thinking, okay. Right. So I'm not like get out, it's a year. They could still meet with me in the general part of my practice. I'm also at the Mind Body Wellness Center, so we could
great.
transfer to there if it's after a year.
Okay, and that's something that's important to know too, that's really where the mind-body side of things really comes into play, is again, there's a large system in place, so we don't want you falling through the cracks.
Yeah.
We're here for you.
Yeah, yep, yeah. We're not going to drop you. We'll.
When it comes to, maybe as you mentioned, troubles getting pregnant, or maybe you lose the child during delivery, what sort of conversations or questions do you get asked during that time? What are some things you can share with us about, couples going through that?
A lot of the time, couples feel like they don't know how to feel, or they're grieving in different ways, so they don't understand each other. They're being really quiet and closed off. They're not talking to me about how they're feeling. I feel like I'm crying constantly, and just how do they connect and support each other, even if they're going through the same thing but in different ways. So that's something that comes up a lot, and just letting people know that it is okay to grieve. It is okay to be crying all day, especially if this is something that is fresh and just recently happened, or even if it's happened a while ago. Part of that grieving process is just waves of emotion will come up when you least expect it. And societally, the idea of crying, there can be so many thoughts around sadness, crying, those kinds of things, like it's weak, or there's something wrong with me, or just my family didn't cry growing up. I didn't see anyone cry, so I don't really know how to let myself do that. So really just offering space for people to grieve, to process, to cry in a place that's non-judgmental, non-critical. I'm not going to be pushing you to move on through this. We're going to be, I'm trying to be there with you through it.
And this seems like it's an area where you probably encounter that quite a bit, because I think in Northwest Pennsylvania, it's, you go to work, you work hard, and you sort of keep your emotions in check. But
Yeah.
The reality is it's okay to experience these things, and it's okay to talk to somebody. You should talk to somebody about it.
Yeah, absolutely. Emotions will find a way out if they're getting pushed down and not being addressed. Like they want to be addressed. Emotions want to. So when you're feeling them come up and not letting them out, they will come out through anger over maybe things that seem silly, or road rage or things like that, or even like headaches, stomach ache, physical ways. So yeah, it is important to talk about, and it's okay, and it's totally normal. Anything that you're feeling when you're going through these kinds of situations is normal.
So everyone's different. Would the course of treatment, let's say, be different for everybody, and maybe how many times they need to make an appointment with you?
Yeah, so that's something that we go over in the first session, whether we want to meet once a week. Generally, it's once a week or once every 2 weeks, but it could be whatever we think. It could be once a month, once every 3 weeks. So it's based on what's coming up for you, and also just the reality of like what your availability is. If you don't have a car, or if you have a unpredictable work schedule, we work with those kinds of things. What was the other part of the question that you asked?
I guess just it'd be different for everybody.
Yeah. So it is different for everybody. Even if two people are experiencing depression, they have different histories, different backgrounds, different ways their families talked or didn't talk about mental health, different underlying reasons why they might be feeling emotionally numb or sad or overwhelmed. So we really try to get into the nitty-gritty, like the roots of what's going on, and that's going to be different for everybody. So there might be some consistencies in things we talk about, or things we, like different coping skills or things like that we are bringing up, but a lot of the work is really self-discovery, like understanding more about who you are, why do these kinds of things trigger me or cause anxiety for me, and what will work for me and how to manage those things.
Again, it sounds like it would be just a great exercise for a lot of people to have that conversation
I think
instead
so.
of bottling it up sometimes.
Yeah, I think everyone should have therapy. I've been in therapy. There is a lot of stigma out there, like that's no secret, but I really don't think that there should be, because you're kind of just consulting with someone on, I'm feeling stuck, how can I feel less stuck? You have training in this area, why not talk to someone?
It's probably almost, when you go to get your annual checkup, and the doctor asks, is there anything wrong? A lot of times people are like, oh, no, I'm fine, but, there might be this, and this.
Yeah.
Again, that's something that you could go have a conversation, schedule an appointment, and those are things you can work out and have these conversations to figure out, so you're not bottling it all up.
Right, and that's another good point. If someone has been just doing that their entire lives, they might really feel like, no, things are okay, but don't, know how things could feel. Or could be if they were opening up or relating differently to their emotions or their thoughts. So in thinking about maybe some things that you might be noticing that would be a good indicator that you're maybe moving into the territory of depression or anxiety, and it might be a good time to talk to someone. If you are having a lot of what if kinds of thoughts, what if this bad thing happens, what if this happens, and it feels hard to control or contain, or if it's taking over a lot of your day, interfering, that would be anxiety. That would be a good indicator to come talk to me. If things are starting to feel so overwhelming or uncomfortable that it's interfering with your sleeping, your eating, those kinds of things, that would be a good sign. And then just distinguishing between, there's the common term is the baby blues. So a couple days after delivering, it's totally expected, normal to have days of maybe worse mood, crying, sadness. Your hormones are changing. Everything in your body is changing after you deliver. And so that's different than postpartum depression. If you're feeling that low mood, low motivation, low interest or pleasure in the things you used to enjoy, feeling trouble bonding with your baby, or having thoughts of harm of yourself, of someone else, any of those kinds of things, and if they're happening for a longer period of time than just a couple days, that would be a good indicator that you're experiencing depression. That would be a good, any of those kinds of things would be a good reason to come talk
Things
to
that
me.
really are sustaining, and again, I think that goes back to, it's okay if you're depressed here or there, or you have anxiety. We all go through this stuff.
Yeah.
But if you've noticed it's maybe coming on more or lasting longer, or maybe when you do have those bouts, maybe it's one of those things in your mind. You say, you know what? Maybe I should just talk to somebody, just so I can kind of keep it in check.
Yeah, and that's a good point too. A lot of the time, I do have some patients that are, they've had, depression or anxiety in the past. They're not really feeling those symptoms right now, but they're kind of just preparing for postpartum and doing more preventive work to bolster themselves for when they get to that time, so that they do have coping skills and those kinds of things.
It sounds like you can have some pretty heavy conversations. What do you do at the end of the day to kind of unwind and relax yourself?
That's a really good question. So I really do try to fully just be present in the session and feel everything that's coming up. So afterwards, I will, take some deep breaths. I meditate, so I will do that. I'll let myself cry. Crying's okay. When I get home, I will play with my baby. I love spending time with her. So, and then now that it's getting nicer out, just being outside, I have music playing constantly. So I will play music, treat myself, you know, get something that I like to eat. I will, you know, just the typical things.
Yeah. Well, you mentioned a good point too. Just to clear your mind, just go for a walk. Healthy, but just get some oxygen flowing and make that appointment and see somebody and have a conversation.
Yep.
If folks have more questions, they want more information, how do they get a hold of your office?
So either way, you can be referred. A lot of my patients are referred from their OB provider. You can also call direct either to the OB clinic or to the Mind Body Wellness Center. Another question I do get is, do I have to be receiving my OB care at that clinic? No, you don't. So my office is in that clinic, but it's a little bit of a separate thing. So yeah, you can just call our front desk and get scheduled with me at either place.
That's wonderful. Well, thank you so much for your time. We've learned an awful lot, and congratulations on growing your practice and just keeping everybody safe and healthy here in Northwest Pennsylvania.
Thank you so much, and thank you for having me.
Yeah, and thank you for being with us here today.